Good morning, doctors. Welcome again. Today we are going to discuss about the MCQs of acromegaly. The theory of acromegaly I already discussed in my video, so please go through that theory and after that solve MCQs. Let's start. Nurse is caring for a silent client with acromegaly. Nurse is caring for a client with acromegaly. Following transsphenoidal hypophysectomy, the nurse should monitor the client's blood sugar. Okay, the nurse should monitor the client's blood sugar. Now, see, monitor the client's blood sugar is the answer. Now, Gemma, whose weight 210 IVS, is 95 kg, overweight, obese, diagnosed with hypoglycemia, tells the nurse that her husband sleeps another room because her snoring keeps him awake. The nurse notices that she has large hands, deepening of voice, we can say hoarseness of voice. Which of the following would the nurse suspect as a possible client's cause of client's hyperglycemia? That is hyperglycemia, not hypo. So here the answer is overweight, firstly obese, then hyperglycemia, snoring due to overweight, or large hands, or hoarseness, deepening voice. These all are features of acromegaly. Yes, so answer here is acromegaly. Remember, let's discuss why. Acromegaly is caused by pituitary tumor that releases excessive growth hormone, is associated with hyperglycemia, hypertension, diaphoresis, peripheral neuropathy, and joint pain. Enlarged hand and feet related to the lateral bone growth which is seen in adults with this disorder. The accompanying soft tissue swelling causes hoarseness and often sleep apnea. Type 1 diabetes is usually seen in children and newly diagnosed person are very ill and thin. Hypothyroidism isn't associated with hyperglycemia nor is growth hormone deficiency. So guys, I think it's clear for you till here. Then okay, next MCQ. Which of the following disorder which results from excessive secretion of somatotropin, that is somatotropin excessive disorder? So answer here is patient with acromegaly. A patient with acromegaly demonstrates progressive enlargement of peripheral body parts, most commonly the face, head, hands, and feet. Cretinism occurs as a result of congenital hypothyroidism. Dwarfism is caused by insufficient secretion of growth hormone during childhood. Adrenogenital syndrome is a result of abnormal secretion of adrenocortical hormones, especially androgens. So, guys, I hope till here it's clear now. The nurse is planning room assignments for the day. Which client should be assigned to be a private room if only one is available? A client with Cushing disease. We are going to discuss Cushing disease in next part. Let's discuss here. Suppressed in ans B. The client with diabetes poses no risk to other clients. The client in answer C has an increased growth hormone and poses no risk of himself or others. The client answer D has hyperthyroidism or mixed edema and poses no risk to other or himself, but Cushing syndrome has. So answer is Cushing. Okay. Patient suspected to having acromegaly has an elevated plasma growth hormone. Acromegaly, the nurse would also expect the patient diagnostic result to include serum somatomedians insulin like growth factor of more than 300. So guys, I hope till here it's clear. Serum somatomedin insulin like growth factor of more than 300 rotation. A normal response of growth hormone secretion is stimulation of liver to produce somatomedin C, which stimulates growth bones and soft tissue. The increased level of somatomedin C normally inhibits growth hormone, but in acromegaly, the pituitary gland secretes growth hormone and despite elevated somatomedian C level. Okay. Now, during assessment of patient with acromegaly, the nurse would expect the patient to report undesirable changes in appearance. This is the answer. Okay. Undesirable change in appearance, rational, the increased production of growth hormone in acromegaly causes an increase in thickness and width of bones and enlargement of soft tissue, resulting in marked change in facial features, oily and coarse skin, and speech difficulty. Height is not increased in adults with growth hormone excess because the epiphyses of the bones are closed. Okay, now a patient with acromegaly is treated with a transsphenoidal hypophyseectomy. Post-operatively, the nurse ensures that any clear nasal drainage is tested for glucose. Assisted patient with toothbrush. Maintain the patient flat bed to prevent cerebrospinal fluid leak. Encourage the deep breathing, coughing. So this is the answer, that ensure that any clear nasal drainage is tested for glucose. Involve entry of sella turcica through the incision of upper lip, gingiva into the floor and nose sphenoid. Post-operative clear nasal drainage with glucose content indicates CSF leakage from an open connection to the brain, putting the patient at the risk of meningitis. After surgery, the patient is positioned with head elevated to avoid pressure of sella turcica. Coughing and staring are avoided to prevent increased ICP and CSF leakage. Although the mouth care is required for our toothbrushing should not be performed at 7 to 10 post surgery. Okay. Confirmatory investigation for acromegaly is insulin induced. No. Here the answer is IGF levels. And paradoxical response to growth hormone release to TRH is seen in acromegaly. So guys, have a good day. Goodbye. That's all for today. I already discussed the growth of hormone increase, tumor like acromegaly, macroadenoma, and that's all for today. MCQs and theory I already discussed. So please go through that theory. And if you like this video, put like on it. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye.